I am Erin Johnson-Cole, and I am faculty at the College of Nursing, and I'm here to tell you about my journey to low-stakes quiz evangelist. So first, a little story of me. I am the Queen of Cram. I've been doing it all of my life. I was a political science major at Yale and wrote every single paper in a frantic all-nighter. My roommates and I had a very full wall of Polaroid photos of all the sunrises we witnessed. I can read over my class notes an hour before an exam and regurgitate them on a test and score in the high 90s, only to have absolutely no recollection of the material the next day. But my system quit working for me here in the health sciences. I found myself in front of patients needing to actually apply all that knowledge. Oops, turns out cramming works really well for short-term retention and pretty badly when you actually need that knowledge for long-term application. So why did I do it? And even continue to do it in my nursing education when I discovered it wasn't working for me. For the very same reason that our students are doing it. They're busy. They have 1,000 pages of reading to do and a job and kids and a toilet leaking and face masks to wash, and well, a busy life such that they tend to rely on rapid methods that offer good short-term results, like cramming. Add to that the fact that our intuition and theirs for how to learn material, namely highlighting, underlining, and rereading our notes, is all wrong according to the cognitive science experts. So fast forward a few years to me in a faculty role, designing a didactic course in our nurse midwifery DNP program. I knew what I had done as a student. I suspected what my students would do. I found myself asking, how could I design my course to help combat this tendency towards rapid but less effective retention strategies? But wait, I found myself asking, is that even my job? Aren't graduate students supposed to know how to do this already? They can read the textbook. Isn't my job to teach them to think critically about all that material? This tendency to discount knowledge acquisition likely comes out of this little pyramid here. We tend to think of Bloom's taxonomy as a hierarchy, with knowledge and remembering being the lowest levels of learning and the creative, critical thinking up at the top. And especially here in the health sciences, we actually need our students to reach at a minimum the applying level of learning, but ideally also the analyzing and evaluating levels to improve patient care and our healthcare system. So we tend to want to jump to those, leaving the remembering part to students themselves, assuming that they already know how to acquire knowledge, or worse, assuming that they can always look things up in today's digital information age. Thank you, Dr. Google. The reality is that most students don't actually know how to effectively acquire long-term knowledge any more than I did as a freshman at Yale cramming all night long. And we actually need our students to have a wealth of knowledge to reach any of those higher order levels of thinking that we want them to achieve. Eccles knew this in 430 BC when he stated that memory is the mother of all wisdom. And Daniel Willingham, a renowned cognitive researcher at the University of Virginia, knew it in 2009 when he stated, research from cognitive science has shown that the sorts of skills that teachers want from students, such as the ability to analyze and to think critically, require extensive factual knowledge. Factual knowledge must precede skill. This should make sense to us. We can't ask our students to think critically about a complex patient condition if the students can't remember the diagnostic criteria. Critical thinking and creativity requires seeing new relationships between and among facts. As students store increasing number of facts, they build a complex network of them, such that new facts are more readily processed and sorted. This network is what allows the student to move up the Bloom pyramid. So back to my quandary as a new faculty member with a didactic course to teach. Knowledge was clearly important. I wanted my students to build networks of it. But how could I design my course in a way that encouraged that without requiring a complete course overhaul? Like any well-trained healthcare provider, I went to the evidence. What did cognitive science have to say on the matter? And I know you're all thinking, wait, I thought this was a presentation about low-stakes quizzes, and I promise I'm going to get to that in a moment. When I went to the research, I discovered these key cognitive science principles that have been shown to improve learning and long-term retention, and these are what led me to low-stakes quizzes. So the first is prediction. Making predictions and actually getting them wrong about content that you don't yet know but want to learn has been shown to increase your ability to retain that material and use that material in other contexts. This has been shown to be especially true for new learners. So why does prediction work? First, making predictions just causes you to pay closer attention. You want to know the answer to the thing that you've just predicted, and the simple act of paying better attention may improve memory. Also, as we've already discussed, when your brain stores information, it does so in this network of other facts, experiences, and perceptions. So when you make a prediction, the brain is seeking out any prior knowledge to help you make an accurate prediction. And this prepares the mind to slot the answer into that network of facts. New facts placed into a network of connections are more likely to be retained and more likely to be retrievable in multiple contexts. From a purely logistical standpoint, prediction preps the students for what the teacher thinks is important, and perhaps like what they should be listening for in lecture. It also indicates for the students where the gap in their knowledge is. You don't know what you don't know until someone shows you, and prediction shows you what you don't know. The power of prediction is summed up really well in the book Make It Stick, which was written by a number of cognitive science researchers. They state, unsuccessful attempts to solve a problem encourage deep processing of the answer when it is later supplied, creating fertile ground for its encoding in a way that simply reading the answer cannot. It's better to solve a problem than to memorize a solution. It's better to attempt a solution and supply the incorrect answer than not to make the attempt. Then we get to retrieval practice, also known as the testing effect. I think James Lang summarizes this best in his book, Small Teaching, when he says, if you want to be able to retrieve knowledge from your memory, you have to practice retrieving knowledge from your memory. The more times you retrieve something from your memory and in different contexts, the more well-worn and varied those neural pathways become, and the easier it is to retrieve it the next time and in different contexts and for different problems. This is why staring at your notes over and over again doesn't work for long-term retention, because the notes are right in front of you and you don't actually have to make your brain retrieve anything. Repeated retrieval embeds knowledge and skills so well that they can become reflexive. We all have examples of this in our own lives and in our own careers. Typing that sentence, for example, I thought immediately, like, that is now reflexive. I know where the keys are on the keyboard without really even thinking about it. And that's because I've retrieved that information so many times. It's a well-worn neural pathway. There are lots of simple examples of retrieval practice in education, flashcards, for example, but any kind of testing counts. As faculty, we tend to think of testing as a means of assessment, but testing can also be a learning tool in and of itself. Cognitive scientists currently believe that long-term memory storage capacity is limitless, but the limiting factor is retrieving information when you need it. Every time we retrieve information, we are strengthening the neural pathway from long-term memory to working memory. This is something we need our students to be able to do, and sometimes very rapidly. There's lots of empirical research to support retrieval practice, with the first large-scale study on it published in 1917. A 2006 recent study found that consistent quizzing increased grades substantially, retention 8 months later, and that students felt that quizzing reduced anxiety over their exams, and 89% felt that it increased learning. And I feel like that has been mirrored in my own experience and with my own students. Then we get to spaced learning, interleaving, and varied practice, which all kind of are somewhat similar and so lumped together. Massed practice, or blocked learning, which is the idea that you go at something with a single-minded purpose, focusing all your attention on that one thing and repeatedly practicing it until you get it right, is a really pervasive idea in learning and is the way most students study. This works really well for rapid results, think cramming, but not for long-term ones. The authors of Make It Stick write that practice that's spaced out, interleaved with other learning, and varied produces better mastery, longer retention, and more versatility. This is because when learning is spaced out, interleaved, and varied, it requires more cognitive effort, not just mindless recitation. Let's define these ideas and talk a little bit about each one and why they work. So spaced learning is when learning sessions on a topic are spaced out over time, usually by days, such that some forgetting happens, but not a complete forgetting. Spaced learning works, one, because it forces retrieval practice, because some of it has already been forgotten a little bit and you have to draw it back into the working memory. And two, because embedding new learning in long-term memory requires this process of consolidation in which memory traces are strengthened, they're given meaning, they're connected to prior knowledge. Again, that's that network of knowledge that we've talked about. But that is a process that can take several days. If learning is masked or blocked, you miss that opportunity to build the network. Interleaving, or mixed learning, is when you spend some time learning one thing and then pause to concentrate on learning a second thing before having quite mastered the first thing, and then return to the first thing and then move on to a third thing and then return to the second, and so on. Varied practice is somewhat similar, but not exactly. It's learning a concept or idea or a skill in a variety of ways. So a great studied example of this is researchers had students throw beanbags at 2 feet and 4 feet, and then another group throw them only at 3 feet. And they found that the students who were throwing them at 2 and 4 feet could actually throw the beanbags better at 3 feet as well. And again, because their practice had been varied. So interleaving and varied practice, students and teachers tend to avoid these practices because they feel uncomfortable, they're slower than blocked learning, and they can feel really disorganized. But the problem with blocked learning or massed learning is that it deepens our association between a learned skill and the specific context in which we learned it, versus interleaving, which forces us to frequently transfer information and skills across contexts. So the research indicates that interleaving and varied practice result in improved mastery and long-term retention. This should also make sense. It's a difficult thing to transfer learning from the original context in which we learned it to a new one, but in the real world, that is exactly what we need our students to do. We need them to be able to assess context and discriminate between problems, choosing a solution from a wide range of possibilities. No patient walks in and says, I am a preeclampsia patient, so use your knowledge of preeclampsia now. Interleaving and varied practice helps students transfer learning from one situation, namely our classrooms, and apply it to another, namely our diverse and varied patients. James Lang says it best. In life, as on final exams, problems and opportunities come at us unpredictably out of sequence. Interleaving and varied practice sets students up to be able to apply knowledge in various contexts out of sequence, as it were. So now on to how did I actually do this? So the first thing I do at the beginning of my courses is I explain to students why the course is designed the way it is in a 15-minute mini lecture on what the cognitive science research tells us about learning. Just like our patients, our students engage more if they understand why we are asking them to do something. Each class then starts, for the rest of the semester, each class starts with a 5-minute pre-quiz. It is short, it is definitely low stakes, and does not count towards their grade. This capitalizes on the power of prediction if the content is something not in the reading, and also retrieval if a question covers something from the assigned reading. After class, I also have a post-quiz of 10 to 15 multiple choice, multiple answer, or fill-in-the-blank questions that counts for 10% of the final grade. To allow some time for forgetting and to increase the cognitive effort, this quiz does not open until the day after class. I don't want simple recitation of the lecture. I want them to have to work for this a little bit. All prior content of the course is fair game, not just the prior lecture, to capitalize on interleaving and varied and spaced learning, and to better replicate, honestly, what students will experience both on their board exams and in practice. Then to engage retrieval, I allow the students to take the quiz as many times as they want, asking them to try the first time from memory alone and explaining to them that they should expect to get some wrong. Answers are not displayed until after the due date, so students can see what questions they get wrong, but not the answers to those questions. As a result, they either have to dig back deeper into their memories or they have to go find the answer. This extra cognitive effort helps the students better understand and learn the material and store it for long-term retrieval. While creating all of these low-stakes quizzes has been a lot of work on the front end, I now have created a huge bank of questions. And in my course evaluation, students have commented that when they saw on the syllabus that there would be quizzes, they were not thrilled. But having been through the course, my students consistently tell me that the quizzes have been the most effective learning tool, that they feel like they know the material better because of them, and that the quizzes have helped them prepare for exams. I even have had students tell me that they take all my quizzes again 2 years later when they're preparing for their board exams. While my initial response to quizzes was to question their place in the graduate school classroom, they are well supported by cognitive science, and my experience with them has been nothing but positive. These are my references. Thank you.